almost at the end of our session of first year. Now I am asking you all these questions. These might be asked during examination. Why you will know within a short while. That's why I want to make you aware of these things. And unfortunately, this will be in biochemistry itself. So, why we chose to become doctors? Number one, what do you think about the privileges you have? All these things have been told in a community medicine class or other classes that I will simply skip. Are these covered in any of the classes? I mean, a few slides I will show you which I took during foundation class, but some of you may, perhaps were not present. That's why only 4 or 5 slides maximum from the foundation course of the day 1 of starting this class. Okay, what do you think about the privileges and the responsibility of the profession? You must understand this thing. And what do you expect from the society? And what the society expects from you? Then what you will have to do and give up in order to meet your own and society's requirements. These are the questions you must try to understand. You will be required to answer. And you must be clear also. The answer may not be universal to everybody. Why you have chosen why do you chose to become doctors? The reasons might be multiple anyway. Now you will have a curriculum and you will appear in the examination, score good marks and will gain some knowledge. What is your opinion? Is the knowledge gained from the syllabus? Marks obtained in the examination and clinical knowledge, what you learn in the clinical department is all to become a successful doctor. What is your idea? After passing MBBS doctor, will this make you a successful doctor? What is your idea? Any of the three or all of the three, you have scored very high marks. You have gained an adequate knowledge, you are having an expertise, critical knowledge, but do you think you will be a successful doctor? Another question, the doctor, loosely used term, the doctor is a super doctor, the doctor is honest, skillful, knowledgeable, hardworking, sincere, devoted, ethical. Are they synonymous? Not at all, not at all. Don't get confused to attribute one quality of a person with the other. Skill is altogether different than honesty. Okay? Knowledge is something else, wisdom is something different. So we want all these things in a medical person and perhaps any person in any profession. Remember, medical is also a profession. Law is a profession, engineering is a profession, teaching is a profession. But I mean, to glorify this profession, it is called a noble. Is the job of a cobbler, or is the job of a teacher, is the job of an engineer? Is not a noble profession. Or the conservancy staff for cleaning your rooms, or the cooks who are making your foods. These jobs are not noble jobs. What do you attribute? It's unnecessary attribution good things about nobility to us. It's not so. So don't get confused. All professions are noble professions. So these are not ethical. Number one, greatest point is ethical. Above all, sober, honest, skillful. Last question is ethical. So, this is the basically big issue. So, ethical doctor means they must have 4 qualities. Number 1, beneficence. You must do something good or best in the larger interest of the patient. Non-maleficence. This is the most important thing. Don't do any harm. If you cannot treat, refer it to somebody else. And most of the doctors, do you think they can diagnose all the diseases? Is it possible? But they do these things. And to get some money, commission, everything, doctor indulge in this particular aspect. Non-maleficence. They do harm by giving some medicines or adopting some surgical procedures. The first and foremost thing, you must not do any harm. If you cannot do good, forget about this thing or don't harm. Third one is autonomy. Respect the decision of your patient. Patient has gotten every right to get treatment from you, to get treatment from allopathy, homeopathy, Ayurvedic, or any spiritual. Give him the autonomy. Don't break his autonomy. Don't try to interfere with his or her autonomy. He is the right person to take the decision of his own life in what way he has come you for consultation. Your job is to give advice, not to impose your ideas onto the patient. If the patient say, I will not be able to do this thing, I am not going to do this thing, fine, think whatever you do. You give that autonomy, don't impose. না এই ওষুধ তো আপনাকে খেতে হবে, এগুলো না খেলে পারবেন না, আপনি পাগল হয়ে যাবেন, আপনি মরে যাবেন, এসব কথাবার্তা বলবে না, একদম বলবে না। যা বলার তোমার টেকনিক্যালি সত্যি কথা বলবে, about the diagnosis, about the truth, whatever you know, that you divulge, but give an option to the patient what he wants, what she wants to do. Number 2, justice. Try to give equal treatment to everybody. The first patient, the last patient, the poor, socio-economic status, ওর বাবা, এর মা, এ ডাক্তার, ও ইঞ্জিনিয়ার, জজ, আর ও গরিব মানুষ, আর ওই বাড়ির কাজ করে, এই ডিসক্রিমিনেশন করতে যাও না, একদমই করবে না। কারণ তুমি জানবে, you all must know that you all learn basically from poor patients. No, you don't learn anything from VIP patients. VIP patients are taken care of by when you become senior persons. You basically learn from the poor persons, relatively lower income group persons. So try to give respect to them and try to help them as much as you can out of turn, I would say. And that was the guiding principles in our department during my functioning. So you must give an unbiased treatment also. So knowledge means you are getting everything, whatever is written in the book, but wisdom is something different. You have to apply that knowledge in the right context. This is the difference between wisdom and knowledge. So you will be endowed with the knowledge from different diverse fields. Now in a given case, you have to exercise wisdom, and in a given situation also. So everything will not be covered in your syllabus. Skills has to be learned from somebody else. You have to either observe or you have to work under the guidance. Skills cannot be attained by online classes or just by hearing. It requires direct observation and direct hands-on training. But since everything will not be covered, there is a good book which I have referred. This is Dr. B.M. Hegde. He is a very knowledgeable person. I heard his first lecture in 1998 at Raulkela, 12th speaker. You can hear his lectures available in the internet, and the first edition of the book was available in 2006. This is the fourth edition, 2014. You can purchase a copy and read after your first crop examination to get oriented. So, you will be a doctor, and since I worked in Durgapur Steel Plant Hospital for 31 years, there is a big picture of Arjun in front of the gate, at the factory gate. So, your aim must be very much perfect, that I want to be a doctor, I want to cater service to the patients, and this is, or whatever idea you have, you must be clear in that. Ethical doctor, I am telling you, that means you have to fulfill all the 4 criteria, then you can be an ethical doctor. It has got nothing to do with your, it will cover knowledge, skill, everything. But these 4 components are essential. If you do not comply, then the principle of ethical will be compromised. Ethics will be compromised. Number 2, what type of doctor you want to be? There are many doctors, you can see they are glamorous. Some might be knowledgeable, but they don't expose. Some had a only motive to have money earning, moving from here and there without having any time to think of the patient. One leg on the train, one leg at the OPD, one leg, hands somewhere else. So, and commercial. There will be many allurements from many angles to do wrongdoing. And some of you might get tempted and you can do it. Don't think that everything will be very much smooth in your life. Expect, after the entry of the gate, just there is a word, be alert, expect the unexpected. Some unexpected things are going to happen at any point of time in your professional career. You must be prepared to meet that situation, to face that situation with a positive impact that I will go and try to solve the problem. Don't get afraid. And since you are having a very, you are holding the highest position in the society, don't try to make a loose comment. You hear from somebody else, but until and unless you are sure or examine the case properly, don't make a loose comment. You see what is inside. This happened while I was cooking. This was cut by me, and I discovered, I took a photograph of this thing. This will be the cases in some of your life. There is no doubt about it. Now, this will be true for every. There are many men also. You will see that man is very good from outside. You don't know what is there inside. Picture will be like this. Be alert for that. Okay, what is the basic aim of this case is transition of a medical student after this curriculum to become a physician. But this process will require lifelong learning, leadership, empathy, and principles of ethics, and which were written very clearly under professional conduct, etiquette, ethics, regulations. I will tell in a short while, and the law of the land. You have to be very much clear. So, you will be the first contact physician wherever you go. So, at that time you will get an opportunity to prove your worth. At the very outset, you can influence the patient, you can make a correct diagnosis. So, you must possess adequate amount of skill to manage the case, at least deliver primary care correctly. You don't know whom, where, how, when. So, basically there are 3 types of care: preventive, promotive, and rehabilitative. All these things you will read in the PSM. The basic aim of this course, CBME course, whatever you say, this particular term was not there in during our time. competency-based medical education. So he must be, that means we are not competent. Yes, we are competent, all were competent. These terms, CBME course, AETCOM, all these things were introduced in 2019 by the erstwhile Medical Council of India. NMC took over in 2020, and from 2021 the first NMC guided courses are there. So they are called CBME, where these particular terms are written. So basically today's class will be on AETCOM. You have heard the term AETCOM? Have you heard? How many of you have heard the term AETCOM? Yes, good. Yes, good. Where from you got it? Where from you got it? How did you come to learn? জোরে বলো, শুনতে পাচ্ছি না। বই থেকে, ওকে, বই থেকে পড়েছে, ফাইন। দেখো, তাই তিনটে ছেলে জানে। See, I think one thing, perhaps all of you have not done it, do it very clearly. Today you go, after reading in the hostel, you do this thing, open the National Medical website, okay, and go on the rules and regulations. You click here. This window will open, Undergraduate Medical Education Board. Note down, Undergraduate Medical Education Board. Click down here, CBME Curriculum 2024. Click on it. You will get the entire details of 487 page, 67 page documents, and that is your course that you have to download and you have to read. I mean, not the whole, but what is related first part and related to first professional MBBS examination. Many things are written. Many persons have not read. You need not require to ask anybody any clarification. Everything has been written very clearly and unambiguously. If you have any doubt, you can have a contact with the NMC itself. Okay. And there is another problem. You just go and scroll down, undergraduate ethics and medical registration board, and there I have highlighted this thing. You click on this thing. There will be a notification, gazette notification on ethics and medical registration board. This is a 124 page document. I have seen it. It was published in 2023, but it was within 3 weeks time. This particular clause was, this particular gazette notification was withdrawn by a separate gazette notification, that this will not be in force. So anything gazette notification means it is a basically order from Government of India. It's a legal binding. So that was withdrawn, and it was written very clearly that the Indian Medical Council Professional Conduct Etiquette and Ethics Regulation Act 2002 will be in force. That is the old one which was made by the Medical Council of India. Now write down this thing, you click it. You will, this is the NMC part was established in 2019, but there was an amendment of this 2002 Act, and these amendment areas are written in red. But whether that act relates to the original 2002 or amended 2016 was not clearly written in that gazette notification. You read it, why I am telling you, you have to read it after the maybe it's only a 14 page document. It will not take much time, you will be able to answer some questions. Why I am telling you? These are all legal documents. It is a legal validity on the court of law. You follow these practices, there will be pressure from many angles, particularly from the senior administrators, particularly from the political persons, to do some wrongdoings, to issue something which is not within the purview of this thing. I am telling you, since I read this thing, my sister was an eldest sister, was a psychiatrist of our hospital. I am telling you one example. one RTI case was filed. The husband wanted to know the details of the wife's disease. And obviously this was repeated from director to my elder sister. She was afraid. Then I said that all medical information are confidential in nature, but don't divulge it. What happened? The basic intention of the person was to divorce the wife on that ground. But she was a secretary, she was labeled as secretary, she consulted secretary OPD, and they maintain in the secretary a confidential register what is the actual problem which is not written in the actual medical prescription. So whenever a case comes, they go to they note down take the reference number, go to the separate room where that register is there under lock and key, open the register, reads it, and then comes back to the OPD. That is the standard procedure. Then I said no, that there is a head-on class between the district judge and myself. I told that under Right to Information Act, whatever be the situation, professional secrecy is one part, it is there in the act. All medical information are confidential in nature and this cannot be shared in public. If required, it can be given in the judge's room only, in confidentially in an closed envelope. After a hot argument, he said, Dada, whatever you are telling might be correct. Can you please go through the RTI Act? There must be exemption. Two acts will not clash together, and there was an exemption. There is an exemption. The such personal issues cannot be divulged. Then I said, then you don't give it. Despite 3 times that notice came, my sister did not give, and I said that I will go with you in the court of law and defend your case. No issue. So this, whatever is written in that clarification in the professional etiquette, so this was written very clearly in your forensic book. I had 2005 5 edition also, and periodically I go on purchasing. This edition is also 2017. So I have read many things which you may not understand properly, but proper clarification has been given. So you can read it. So today's class now I am just, it is almost half an hour. AETCOM. AETCOM stands for, remember at least what is AETCOM, you must be able to tell. AETCOM means attitude, ethics and communication. Attitude. This one, A is attitude, ET is ethics and COM is communication. It's a mandatory part, and in all of your longitudinal program means in all phases of your MBBS it will be taught. So basic principle, guiding principle of it is you have to have an empathy. Sympathy and empathy is altogether a different issue. Sympathy means you are having a compassion. Empathy means you are trying to somewhat internalize and trying to almost getting involved into patient's own feeling. That is empathy. Patient is telling some pain, you imagine that you are suffering also from that same pain or the same experience. Bioethics, as I have told you, teamwork will be the leader. Wherever you are there, under you, nurses will be working, paramedical staff will be working. So teamwork, good teamwork is there. Effective doctor-patient relationship, no doubt about it. How will build up, that requires a good amount of communication skill, understanding, motivation. Many aspects are there to make a good relationship. In the social relationship, whatever we maintain, this type of relationship will be required. And unfortunately, and the most important thing, why? Because this will be evaluated during your internal assessment and final examination, university examination. This is the most important part for you. That's why I am trying to highlight this thing. So in phase 1, where you are, the focus is on foundation of skill, communication with the patient, and introduction to professional development. Assessment. Now come to this part. This is the reason why I have taken this class. Theory examination, both internal, so far we have not made any question on this. Now you are likely to expect. At university examination require at least one application based question accounting for 5% of the marks in each paper. And everything is written in that CBME guidelines, whatever I have told you. You read it thoroughly, I will tell you something. As practical critical explain, because why I have told you the questions in the beginning, because it might be asked in practical examination, viva. It is possible. I mean, it depends on the examiner. So, what is an attitude? How do you define? At least you must be able to tell what is defined, what is an attitude. A Merriam-Webster dictionary is very, most regarded dictionary for USA. Oxford dictionary is for UK and is globally recognized dictionary. You try to at least say something. What is an attitude? Don't keep blank. Say something positively with a reference that Oxford dictionary says like this. Yeah, I tried to find out what the Indian law says about attitude. There is no actually single definition, just like photosynthesis or just like respiration, no single definition, but there is psychological definition adopted in law is affective. I mean, is your feeling and emotion, behavior, your tendency to act, and cognitive means your belief and knowledge. This is basically an attitude, what type of attitude you are having with the patient and your peers or the subordinate staff. Second, ethics. What is ethics? Again, I tried to find out. It basically deals with the moral principles. Okay. So, again, Merriam-Webster dictionary I have found. At least you try to, say something about this thing or write something about this thing from one source. That will be sufficient. Again, Indian law, because legal term, I am very much fond of law because, and everybody will say he will apply any rule or law in some situations. So, you must read law and rules and regulations very clearly and point out the mistake whosoever he is. Don't think any person senior to you or holding a position has read that thing. The moment you take that document, the legal document, he cannot defend. He has to accept. And that happened in this college also. Anyway, so ethics is basically binding code of moral principles. So, communication again, what is communication? We are communicating with languages, with body languages, this thing, sounds, gesture, posture, but all the living beings are also communicating with each other. If you see the track of the ants, they are communicating by, touching the mouth. Some message is conveyed. Cell to cell contact, communication is there. Okay. So, basically sharing of information from one to other. So, in that document, you will see what is the subject goals for biochemistry and you have to answer because of your examination. In that document, you will get this thing. A page number is here. Then objectives of Indian medical graduates. What are these things? I have highlighted this thing, goals for the learner. Basically, there is a component of AETCOM which I am trying to emphasize in today's class. So, lifelong learner, doctor has to be a lifelong learner. Number one, lifelong learner. Number two, professional, critical thinker and researcher. Critical thinker doesn't mean, critical thinker basically means that you have to critically evaluate each and every case, not what somebody is telling. You have to apply your own brain and don't ever think that you are a less knowledgeable person than somebody else, or your analytical power is inferior than somebody else who is well known. Answer is no, no and no. Maybe one day when you will attain his age or her age, your critical thinking will be much ahead of that person whom you thought to be too much critical. And until and unless you critically think, you really cannot exercise wisdom. And lifelong learner, that is leader and a member. Who is a leader? Oh, who is a leader? You are the leader in your area. If you work in a primary healthcare setting as a medical officer, remember there is a difference between a medical officer and a clinical expert. Medical officer means there is an office attached to it. That means some administrative works are there. You are not alone. In that health center, nursing staff will be there, paramedical staff will be there, other office staff will be there, conservative staff will be there. You will be the leader. And what a leader is, he has to walk the talk. Means whatever he will see, he must have the potential to show it. He can do it. And number two situation, there will be awkward situation as I told you. Expect the unexpected. When the going becomes tough, with tough get going. You must daringly face that situation and set an example. And that is the time when you will prove that you are altogether something different. This happened to me also. A patient died, hospital, there was a ransacking going on. I heard the new information from over telephone, then I said that I am going. No sir, you don't come. Sir, you don't come, people are very much angry, you will be hurt, you will be injured. And I drove my car and entered into the hospital. Believe me, nothing has happened. The moment they saw me, they became quiet. I went to the situation and wanted to assess and allowed the entire gathering to react spontaneously. And after some time, everything settled. Nothing has happened. Nobody hurt me. So don't get afraid of it. If you get afraid of it, your house will be also ransacked. So, leading from the front, number one. Face the situation. কেউ যাচ্ছে না, আমি যাব। আরে মরতে মরব। এরকম অ্যাটিটিউড থাকলে তবে তুমি লিডার হতে পারবে। Role model, play the role model, and you have to have all these qualities like honest, modest, good, courteous, prompt decision. First and foremost, you have to take a prompt decision, and then you have to implement it. আমি কনসাল্ট করব ওর সাথে, সে কি বলবে তার সাথে, তারপর আমি কাজ করব না, এটা হবেই না। ইমার্জেন্সি সিচুয়েশনে তোমাকে তোমার নিজের উইজডম এক্সারসাইজ করতে হবে। এবিলিটি টু ইনফ্লুয়েন্স কুইকলি the entire team, far-sightedness, too intelligent you have to be, too shrewd also at the same time, highly knowledgeable and critical analyzer, I have told you. So communicate with the patient, family and colleagues, and you have to talk in a language which the patient or the patient party will understand. If you go through the prescriptions, you will not be able to understand the handwriting. You will not be able to read what are the instructions given. ওষুধ যে খাবেন 3 বার 2 বার 4 বার 3 বার 5 বার বলে দিল, লোকটা 4 বার 5 বার খাবে কখন? এটা 2 বার, এটা 3 বার, এটা 4 বার। আরে কোন সময় খাবে? খাবার আগে খাবে না খাবার পরে খাবে? কতক্ষণ আগে খাবে, কতক্ষণ পরে খাবে? এবার বলার পরে তাকে জানতে হবে যে সে বুঝলো কিনা কোন ওষুধটা কোনটার আগে খাবে। একদম বলে না, কেউ কিছুই বলে না, আর সবটা ইংরেজিতে লিখে দেয়। ম্যাক্সিমাম লোক কোথাও ইংরেজি যায় না, পড়তে পারে, ডাক্তারের ল্যাঙ্গুয়েজ পড়া আরও ডিফিকাল্ট। যে মেডিকেল শপে গেল সেও যে খুব ভালো করে বোঝাবে সেও না, তার কাজ হচ্ছে গিয়ে ওষুধ এসে দিয়ে দেওয়া। অ্যাট দ্য এন্ড পেশেন্টটা তোমার কাছে ফলো আপে আসবে। এটা হয়েছিল আমার পক্ষে, আমি বলে দিচ্ছি। এ পেশেন্ট কেম উইথ এ ভেজাইনাল ক্যান্ডিডিয়াসিস। I prescribed oral metrogyl and candid vaginal tablet to be inserted in the vagina. And after 7 days, the patient came with a, ভালো আছে, ঠিক আছে, না সেরকমই আছে। আমি এক্সামিনেশন করে দেখলাম তখন আমি ইন্টার্ন। On inquiry, I found that he has taken candid tablet orally and inserted metrogyl vaginally, despite having that applicator available. So you have to cross-check. If required, you have demonstrate it. A lifelong learner. There is no stoppage. Do you think I have stopped learning? What is your idea? I mean, I have made a career after MDA continuously. Last year I appeared for an examination. This year I have, in April, I have enrolled for the course, for a fellowship course for 1 year, and I am attending the courses. I have purchased book also. So I am still learning at the age of 64. I am a student. So these things you read it so that you can write something. I am not going into the detail. All these things are written. See, in this 4-year part, this phase 1, 2, again I am telling you, this part AETCOM module is there. But the main thing which I am now coming to this place is in biochemistry paper 1 there are 2 questions, and paper 2 there are 2 questions. And I am trying to address these 2 questions right now. Okay? You just open this thing, read this thing, make an answer to it in your own ways. I am trying to highlight this thing. The first paper is enumerate and describe professional qualities and roles of a physician. Now, if you look at this thing, see anatomy, physiology, biochemistry, the course, it is related to biochemistry. Now, among the 3 subjects, you know who is the leader now. Why this question has been given to biochemistry? Why not to anatomy, not to physiology? Physiology is dealing with the medicine almost mostly. But the question is specifically related to biochemistry. Okay? So, enumerate and describe the professional qualities and roles of a physician. Describe and discuss commitment of lifelong learning as an important part of physician growth. First question, enumerate and describe. Listen very carefully. You write down all these points. Okay? And if you cannot remember, just write number 1, respect for the patient. First and foremost, the patient comes, "Hey, ki hoche ki? Kothay boshe achen? Ki bolchen esab?" Don't react so badly. The patient has come maybe after a long distance with some expectation to get treatment. So respect that patient, take him as almost a guest like thing. You will be respected also. And unbiased treatment, irrespective of the socio, as I told you, justice, one of the point of ethics. So you have to be irrespective of the socio-economic status, gender, race, religion, caste, whatever be the situation, he or she is a patient after all. He has come with some problems which pained her, which he or she could not manage. That's why, এই তুই ফটো তুলে কি করবি, লিখবে, তুই ফটো তুলে যাই যে আরে কথা বলছিস, আমি দেখেছি তোকে নোট করেছি, আমি তো এই কোশ্চেনটাই জিজ্ঞেস করবো, এই সব কটা পয়েন্ট তোকেই জিজ্ঞেস করবো স্পেসিফিক্যালি। আমি বলে দিলাম, বলছি এটা শুনতে লিখতে, ফটো তুলে সব কিছু বইয়ে লেখা আছে, কোথাও না কোথাও পেয়ে যাবি, পাবি। শোন বসে বসে চুপচাপ, যতটা পারিস মনে রাখ। লিখতে বলছি একটাই কারণে, তাহলে কিছুটা মুখস্থ হবে, কিছুটা লিখতে পারবি, 2-4টা কথা লিখলে পাস করে যাবি ফার্স্ট চান্সে। এই জন্য আমি বারণ করি, ছবি তো আমার কাছে নিয়ে নেয়, গোটা জিনিসটা আমি দিয়ে দিচ্ছি, আমি নিয়ে কি করব? এগুলো তোদের জন্যে, আমার জন্য নয়। So number 1, number 2, compassion and empathy. You have to be a little bit kind, you have to be a little bit human. And the empathy, as I told you, you have to share the feeling of the patient. Professional experience and commitment. You need to have a professional experience. You need continuous reading, continuous growth, acquiring knowledge and skill. Then only you will be able to exercise professional excellence. Confidentiality, as I told you, all medical information are confidential in nature. Do not ever divulge of any illness to any other person, whosoever may be. maybe even to the husband, maybe to the employer also, until and unless it is of public health importance. Suppose there is an outbreak of dengue here, outbreak of cholera. That means the mosquitoes are infected, mosquito control will be required, otherwise many persons will be suffering from dengue or malaria. Or if there might be an outbreak of gastroenteritis. In that case, you have to, inform the appropriate medical authority to take immediate measure, so that whatever the mosquito, anti-mosquito measures will be there, that they will take. And if the water is contaminated, proper immediate management has to be taken, because other large number of people will be affected. So, until and unless it is of public health importance, do not divulge it to anybody. Even an employee might want to know the status by the employer, that what the patient is suffering from. You will not divulge it. Never. Oh, no, this is not my business. Court of law, as per law, you try to manage this law, again, Right to Information Act, Indian law, Medical Council Act, Professional Etiquette Act, try to judge. Professional secrecy and delicacy, every problem, every concern, problem of the patient is a delicate matter. You handle it properly. Integrity and honesty. Whenever you see the patient is having a cancer case, suppose, example, I am telling you, or end stage renal failure, you have diagnosed the case. How will you divulge the patient is in an end stage cancer is a very difficult issue. Divulge, you have to need the art. There is a separate class. If you want, I will tell you how to divulge the truth in such, very bad condition when the patient may not survive. And if you can diagnose, if the patient asks, Doctor, আমার কি ক্যান্সার হয়েছে? হ্যাঁ, একটু ভালো লাগছে না আমার দেখতে, বুঝলেন, একটু পাঠাচ্ছি, একটু টেস্টগুলো হোক, দেখি। তা এতটা টেনশন করার মতো কিছু নেই। বাড়ির যে রিলেটিভ আছে তাদের একটু অ্যালার্ট করে দেবে। পেশেন্টটাকে কিছুদিন চট করে বলতে যাবে না যে আপনার ক্যান্সার হয়ে গেছে বা টার্মিনাল স্টেজে চলে আসছে। পেশেন্ট বাড়ি পর্যন্ত হয়তো যাবে না, সেটা মাঝ পথে ফেন্ট করবে, তার ডেথ অ্যাক্সিডেন্ট হয়ে যাবে। যাই হয়ে থাকুক, you don't know how long the patient will survive. There are many survival mechanisms. So, even if you diagnose the case, you tell the details, no doubt, but in a proper way. That is truthful, basically. You try to communicate accordingly, and you must be honest about diagnosis, treatment, and the outcomes also. And in the course of treatment, you are likely to commit error. There will be error. You please admit it. Please apologize before the patient for making the constant. It will douse the flame immediately. And if you try to defend it, then you see you have to, tolerate the reactions. This happened in my department. Somebody committed a mistake and they divulged it to me. Then I told that you be out. I am taking the responsibility. Before the public, I will tell I have done the test. And there is a pressure by our hospital head to hide the truth. Then I said, no, I am not going to say the truth. Let me have a punishment. Whatever the punishment gives, I will go to the court and tell this has happened unintentionally. And unintentional happening and admitting in the very first instance will basically eliminate most of the problems and almost all the problems. I am telling you, with a folded hand request that I made an error, unintentional, it was beyond my knowledge. Please, what punishment you want to give me to me? And that will simply pacify the entire situation. Accountability, you have to account to the patient, whatever you are doing, to the relatives, to your peers, to the institution, to professional bodies, because Indian Medical Association is there to safeguard if some wrongdoings are done on you. And Medical Council is there to take punitive action against you if you have done something wrong. Then Medical Association is there. They can also fight for your case if you are not at fault. Altruism means পরোপকার্থে জীবন উৎসর্গ করা। So you have to have an altruistic measure. Priority of your patient is need. I give an example. Suppose you are you are marrying your father, your daughter have son, and you are arranging the marriage. Suddenly, patient came with liver or requires an immediate surgical intervention. What will you do in that situation? If you leave that marriage place, try to serve the patient. Don't think that everybody will blame you, everybody will appreciate you. In that case, by chance, if the patient survives, you can delegate the power immediately to somebody else. You arrange the marriage, let me handle this patient. If you are in a remote place, it can happen. The patient has come in there with liver. The arrangement and the nearest healthcare facility is something 30 or 40 kilometers away in the night. What you can do? You simply prioritize the area of patient. That is altruism. So roles, first and foremost, triad, care provider, expert medical person, primary care physician means the first contact will be there. So you will manage primarily. You will manage the primarily. After some time when the patient will recover, he will think of that I will go to Apollo, I will go to Hyderabad, I will go to Chennai, this thing, that thing. And there are big doctors are available, but you are not a big doctor because you have managed well and you are working in Santiniketan Medical College in a medical, I mean health center. They will realize it later when somebody at Apollo tells that they have managed it very correctly at the health center level. Then that person will realize that yes, right treatment was given. Poonam Mukherjee, when he was the president, was suddenly injured in a road traffic accident, and he was brought to the nearest health center where stitches were given, and then the army flight, helicopter came and took him to Kolkata airport. From there he was flown to army hospital. So you don't know whether in a healthcare center in a remote, whether Prime Minister or Health Minister or President of India, whom you are going to treat. So communicator and educator, as I told you, team leader and collaborator, you are the team leader, the ethical decision maker. Means end of life care, person is going to die and there are some persons who can be treated. So you have to prioritize that patient. That those who are having an end of care life, you make a separate arrangement for him, and those who life can be saved and can be given a normal life, you make a separate arrangement for that. So that ethical judgment you have to give in, you have to prioritize this area. Public health advocate, you are the public health advocate, some outbreak is there, you have to control it and then communicate to the appropriate authority to take measures or to solicit help. They will give it. They will give it, definitely they will give it. Only thing is that people do not communicate properly. Out of fear psychology or something. আমাকে কাজ করতে হবে তো, আমাকে বললে থাকতে হবে, তাহলে আমরা প্র্যাকটিস করতে পারবো না, চেম্বার করতে পারবো না। ওই এসকেপিক স্ট্র্যাটেজি নিলেই বিপদে পড়বে। যখন ক্রাইসিস হয়েছে, যখন ক্রাইসিসটা ম্যানেজ করবে আগে, মেডিকেল ক্রাইসিসটা। কেউ তোমাকে কিচ্ছু বলবে না। রিসার্চ অ্যান্ড স্কলার। So the research medical, if you don't do a research work, wherever you are there, you will get some unique findings. That unique findings you have to share with somebody in the conference or in the form of a published paper. Otherwise, how other people will come to know? So this is one of the greatest things which is lacking. There are many physicians, surgeons, good doctors are available, but they don't want to spend time on publication of the new cases what they have seen, because it will require a considerable amount of time of writing that paper, communication to a journal. Of course, their income will be compromised. And yesterday I talked to an urologist, neurosurgeon. Sorry, why don't you spend a little bit of time in publishing all the new cases what you have seen or the professional failures in your life? You are all not successful. You publish a paper on the failures of my professional life. I said, okay, I will discuss with you, I will come to your department. I told them that you publish a paper, the failures in my professional life. You highlight some of the failures so that others will learn from you. So in the medicine, the second question is a commitment to lifelong learning. So, this is an important part of physician growth. You will read Harrison manual book and many medical books. In the first opening chapter notice, I have been seeing from almost 2002 edition that medicine is an ever-changing science. Continuous research work is going on and that information is being included into it. And if there is an error, if you find in during the preparation of the book, the author is not responsible. You point out to the author, he will rectify, they will respond and rectify it. So, medicine is an ever-changing science. So, since it is an ever-changing, it is not that Gayatri mantra, it is not that Durga Pujar mantra. যে ওই একই মন্ত্র সেই আমার দাদুর সময় বলেছিল, তার দাদুর সময় বলেছিল, আমিও বলছি, আমার ছেলে বলবে, আমার নাতিও বলবে। না, এরকম নয় ব্যাপারটা। মেডিকেল সায়েন্সে সি চেঞ্জেস হয়ে গেছে। আমরা যে সময় পড়েছিলাম এখন যা হয়েছে। তো তোমাকে ইউ হ্যাভ টু কিপ abreast the latest developments of knowledge by reading journals and the latest books. All the books you must keep wherever you go from the undergraduate level. These books are treasures. You remember, a doctor is a student. This slide I will show you until he dies. If he considers himself not a student, the doctor within him will also die. First and foremost, never lose the reading habits after you become a doctor or practicing. Read at least 1 or 2 pages every day. And that was told during my entry in Durgapur Hospital, Stilton Hospital. Sahab, in the evening just read only 2 to 3 pages of whatever you have written read in your undergraduate or postgraduate level. And I practiced that thing. After the death of the our director, I dedicated my PhD thesis to him. I made a PhD because of the statement which was given to him, that motivating statement. So, reading will not be sufficient. You have to understand. Once you understand, then you have to realize, and then you get enlightened. And this is a continuous flow. It will not happen overnight. So reading, listening and observing, and then you try to understand. So, if you go to the principal office, the day I came, this particular display board attracted my attention, and why I read daily, that answer I got it, and why I am still a student, that answer is also written in that display board. You take a photograph, it was quoted by Tagore, but eye-opening statement. A leader, a teacher can never truly teach unless he is learning himself. A lamp can never light until it is burned, continues to burn on its own flame. The মোমবাতি নিভে গেছে, সে আলো দিতে পারবে না, সম্ভব না। ওই পুরনো নলেজ যা নিয়েছিলাম সেই নিয়ে যদি তোমাদের আজকে পড়াতে যেতাম, আমি আজকে মিজারেবলি ফেল করতাম, সিলেবাসটাই কভার করতে পারতাম না। এই স্লাইডটা তৈরি করার জন্য কাল একদম ট্রেক 5টার সময় শুয়েছি আমি, আর তৈরি করছি 1 সপ্তাহ ধরে এই কটা স্লাইড। So, প্রথম কথা, whatever, everything you will not get it, even in the best of institutions. So, whatever thy hand findeth to do, you do with thy might. And learning is a lifelong journey. Without constant reading, encountering problems, actually there will be no real learning. You have to put the knowledge into practice, and those who are become successful in their professional life, their path was never rosy. It was thorny and trouble-torn. Science কিনা দেখো তো, আমি চলে যাই সেকেন্ড কোশ্চেনটা অ্যাড্রেস করে দিয়ে চলে যাচ্ছি। Describe and discuss the commitment to lifelong learning as an important part of physician growth. So, first and foremost, rapid advancement of medicine is there. So, you have to know the basic sciences, diagnostics, therapeutics and recent treatments available. Okay. For that, what you can do, continuing medical education program is going on continuously. Okay. So, reading medical sciences related to your area of interest, many journals are available, literatures are available, do read. And then after you read, you will have an idea and start writing also paper. When you write, you will understand your own deficiencies. You cannot express properly. So start writing from the very beginning of your career, what I did while during my PG studentship, from that time onwards. Okay. So attend conferences, workshops of your interest. Not all, it is not possible. Too many conferences, too many workshops are going on every day in this country. Professional development and leadership, you will learn from your own mistakes. If you cannot learn from your own mistake, then nobody can teach you. Nobody can be a better teacher than your own mistakes. And you try to listen from somebody else what mistake they have committed. So you try to learn from others also. Feedbacks, get a feedback from the patient, student, peers, everybody. Criticism, please accept criticism. Very, very sportingly. And in the hospital, I am telling you, out of 148 doctors, a lone candidate who had to fight against 147 doctors on one side, hospital staff, paramedical staff, and I am the helpless person working in a department in the biochemistry, fighting with each other that your reports are wrong, your reports are wrong, your reports are wrong. Finally, I established after 15 years that whatever reports your biochemistry department is given is unchallengeable simply. So that you must face the criticism. In fact, I have accepted all the criticisms and converted the criticisms into creativities by acquiring degrees. PhD I have done, and I have published 14 research papers which nobody could do it in our hospital. They criticize. Remember, criticizers are born to criticize. Creators never criticize others. They continue on creating. Be a creator rather than a criticizer. Don't waste time criticizing others. Try to criticize yourself and try to develop. Yes, sir. Patient safety, online question asked. Online courses are available, formal courses are available, which I have enrolled. Particularly, you apply for those cases where there is an examination, theory and practical, so that if you appear in the examination, you will read very seriously. Only attending conferences, simply it will go out from. You have to read, write, and then you have to appear for the examination to pass. Legal and ethical accountability, growing awareness of patients through media. Remember, patients are very much aware of their own rights. Google is there, so Google doctor is there. So they will go do the Google doctor, and now today AI is also there. They will put their signs, symptoms, and then particularly educated one, and they will go on challenging. So they know that doctors are involved in the commission business. তুমি একটা ইনভেস্টিগেশন লেখো, ও ডায়াগনস্টিক সেন্টার থেকে কমিশন দেবে, সেটা পেশেন্ট জানে, বলে ওই পেশেন্টই চলে যায় ডায়াগনস্টিক সেন্টারে, আমাকে এটা করে দিন না, 500 টাকা লাগবে। আরে আমাকে তো আমি নিজে এসেছি, 100 টাকাতে ডাক্তারকে কমিশন দেন জানি আমি, আমাকে 100 টাকা কম করুন। কে জানে কে কমিশন নেয়, কে কি করে না করে, সব পেশেন্ট মোটামুটি জানে। একটাই ভালো জিনিস শুনে নাও, ভেটেরিনারি ডাক্তার যারা আছে তাদের জন্য বিরাট বড় মেসেজ আছে। অ্যাটলিস্ট তারা বেঁচে গেছে, তাদের পেশেন্টগুলো গুগলিং করতে পারে না। Google doctor is not there. This was sent by one patient whom I have treated. He was panicking, and at the end, after reassurance, when he got cured, he sent this message to me that okay,